Hey guys, I am the nurse Dr. Asia, and today we will be administering blood. So let's get started. So first we're going to get our patient, and we're going to actually verify that we actually have an order to give the patient's blood. So let's say that you see that the patient's hemoglobin is a 5. You can't just say, oh, we're going to give that patient some blood, but you must have a physician's order in order to give blood. All right, so another thing you need is you need the patient's consent. So let's say that this is the patient's first time receiving blood during this hospital stay. You will need a consent, and each facility is different about how long the consent is good for. Some hospitals it's good for that entire stay. Other hospitals it may expire weekly. So you want to check with your facility to see how often do you need a consent. So the consent just says that the patient consents to receiving blood. So we have our doctor's order, we have the patient's consent, and then you need to do a patient's crossing screen. Typing screen, you need to do a typing screen to see, what blood type that the patient has. So you want to go ahead and draw that and send that off to the lab. And the lab has said that your patient blood is ready, so you now can come to the blood bank and go get the blood. So what are some things that we want to do? So first we want to get some pre-blood vitals. So we want to get some vitals and make sure that we get a good baseline of the patient. Also, we want to check the patient's IV to make sure that the IV is working. So most facilities say that they want the blood ran through a 20 gauge or smaller. So you want to make sure that you have a working IV. Also, if your patient had any type of pre-meds that the doctor may have ordered, the doctor may want them to get some Tylenol, maybe get some Benadryl. So you want to make sure that you have done those things. And after you've done those things, then you want to go get the blood. Also, what I like to do is I like to go ahead and get my tubing. So the tubing that you will be using is your Alaris pump infusion, and it's going to be the blood set. So you want to make sure that you're only giving blood in a blood tubing line. Next, you want to get your normal saline. So you want to just get a small bag of normal saline. This right here is 250 mLs, and you want to get this. So you want to have this already in the room ready. So when you come, all you have to do is assemble it. So first what we're going to do is we're going to wash our hands, and we're just going to check the patency of our IV, because we want to make sure that our IV is working. All right, so we're just gonna flush with some saline. And we're just gonna flush it to make sure the IV is working. So we don't see any swelling, we don't see any redness, and the patient is not complaining of the IV hurting or anything like that. So we know that this IV is good. All right, so let's go to the blood bank and let's go get our blood. So I have retrieved my blood, and it says that this is A negative blood. So I went through this process with the blood bank receptionist, and they made sure we did all these checks to make sure that this is the correct blood. So I'm not going to go over all those logistics because that will change depending which facility you go to. So I now have the blood. So I now have 30 minutes to give this blood before it's no longer any good. All right, so we need to start the blood within 30 minutes of getting it, and we're going to have 4 hours to administer this blood. So let's get started. I'm going to hang this up here. And I'm going to go ahead and do hand hygiene. And I'm going to put on my gloves. So we've already checked the patient's IV. We see that the IV is correct. Now, like I said, each facility is different, but we need to make sure that we have confirmed our patient's name and date of birth along with their blood number, because we want to make sure that we are administering the blood to the right person. So this is also would be a time that we would grab another nurse. So 2 nurses would need to check off blood, okay? All right, so we've already verified this patient. This patient is the patient that this blood is supposed to go to. The patient is A negative and they are receiving A negative blood. So I got my blood hang up here, and then I'm going to get my saline and I'm going to hang that up here. So the next thing we're going to get is our blood tubing. So let's look at the differences with the tubing. So we see that we have two spikes right here. So one is going to spike the blood and the other one is going to spike the 0.9 sodium chloride, which is our normal saline. You guys, you can only administer blood with 0.9 sodium chloride. Okay? All right, so let's begin. So we want to just finish looking at the tubing. So it's set up just like a regular tubing, IV tubing, except it's blue and it has these two spikes down here. So we're going to go ahead and take that part off. And then also we're going to just take this little part off that's keeping it all together. All right, so what I like to do is I like to go ahead and close the roller because now it's open. So I like to close it. All right, so the first one we're going to spike is our normal saline, okay? So just think about it like this. Before we prime the blood, we then want to prime it with the normal saline. So you're going to spike the normal saline first. So also, let's pause for a second. Let's look at these clamps right here. So we're going to want to close off the clamp that we're not using at the time, okay? So only one clamp should be open at a time. All right. Take that cap off, and we're going to pull it down right here, and then we're just going to go straight up and push it all the way up there. All right, so then remember we're still open, so then we're going to squeeze this chamber, and you can see that it's coming down here, right? So you see how the chamber is filling up. All right, so we want to prime the line. So we want to open the roller clamp, and then we're just going to prime the saline all the way down the line. And you don't want to do it so fast because that's when you get a lot of air bubbles. So you see that the saline is all the way at the top. Our normal saline is already primed, so we don't need the normal saline right now. So what is the purpose of the normal saline? The normal saline is just there to flush the blood on through. So let's say that when you're finished and you just have some leftover blood in the tubing, the saline is just there to carry, you know, the rest of the blood to the patient so the patient can get the whole amount ordered. So we're going to close this one. We're going to clamp this one off because we're done with it. Now we're going to open up the other side, and we're going to pull down this little tab right here, and we're going to spike the blood. So we're going to take our cap off, and you can fold this back, and then you're going to go straight up, and you want to push it in. All right, so we now spike the bag. So we making sure that this one is locked and this one is the only one open. So we're going to squeeze it, and you see your blood is coming down. You can prime by gravity. So the same way like you did the saline. So you want your blood to get all the way down to the tip. So what you can do is just open up your clamps and squeeze your chamber. And you want to make sure that you hold this over a trash can, okay? Because the saline that was first primed, that's going to be in the line. We just primed. All right, so now our line is primed with blood. And now I will be able to connect it to the patient. I will make sure that it's locked. And it is locked. And then I would put the line in the machine. And then I will go to channel select, and I will go to IV fluid, scroll all the way down to blood. All right, and then I will set my rate to 75 mLs, and I will set it to 300 for your volume to be infused. And there you go. Is for the first 15 minutes, you have to stay with that patient. So why 15 minutes? Because within the first 15 minutes, that's most likely for a patient to have some type of reaction to the blood. So you want to stay with that patient for the first 15 minutes. And after that 15 minutes, you want to document their vital signs and then compare it to your pre-blood vitals. So you guys, I hope that this video was helpful for you learning how to administer blood.